and entertained. Visit the Auditorium, Louis Tussaud's Waxworks, the incredible 4D moving theater, and more. Come and experience the wild and weird this summer.
Welcome back to San Antonio Living. If you're like me, you're always trying to look your best and you want to know what's out there to help you do it. Well, this morning we're sitting down with Dr. Shaw and Laura Frisk, one of his patients. It's good to see you both.
Good morning, Shelley. Thank you for having us.
Yeah, you know, this is something my girlfriends and I talk about this all the time. We always have questions.
Sure.
And I'm sure our viewers do too. So we've got a lot of great information on what's out there, what you can do to put that best face forward.
Okay.
All right. Tell me a little bit about your place. You are in the Stone Oak area.
Yeah, we're right on Stone Oak Parkway. We do facial plastic surgery, just the full spectrum of facial plastics from skincare to surgery.
Okay, and that's important because you really want to go see someone who is very familiar with the face, and that's what you concentrate on.
Yeah, my practice is limited to cosmetic surgery of the face and neck.
Okay. And really, see, the rest of this is under clothes, so it's fine. I got to concentrate on this. And I think that's where most women start, don't you think?
It is a very visible thing that, you know, it's not something we can cover with a pair of jeans, you know, so it is something that's very, very overt.
Well, one of the things I think that most women turn to first is Botox.
Sure.
And Laura, you recently had some Botox done.
Yes, I did.
You look gorgeous.
Thank you.
I want to take a look at your before pictures, though, and we'll see. This is something that so many women want to do. They want to smooth out the lines around their face. They want it to be natural, though. And this is a great option for them.
No, I think the injector is critical, and you know, Botox is Botox, but you know, it cannot be cookie cutter. It has to be tailored. You know, we have a beautiful woman here. We want a natural result and just keep her looking as fantastic as she already does.
You look beautiful. Look at Laura now. Absolutely gorgeous. And it does look very natural. And I think that's what's important. That's what you've got to take into consideration when you go see somebody. Because if you put it in the wrong spot, you're in trouble.
You can get into trouble, so we tailor each treatment to the individual patient and what they're looking for.
I've got a couple more befores and after. These are some of your patients that have had Botox.
Yes.
That's an area that women don't like wrinkles, that frowny spot.
We call it the infamous number 11 sign, so we can treat that very effectively with Botox. It's very effective for these what we call dynamic lines that are formed by underlying muscle contractions. So in the upper third of the face, it works quite well.
Now, we were just having a discussion because we have, I'm 39 years old. Leslie's a tiny bit older than me. We had Jamie in here. She's younger than me. We've all had Botox. But is there an age where you can get Botox? Because Jamie was saying, I get it because it keeps me from getting frown lines.
It's individualized to the patient, and so we assess each patient. It is a preventative measure, so that the thought process is if you keep these lines from forming in the first place, you're just one step ahead of the game, along with skincare, skin products, things like that. It's a nice preventative measure.
You brought in some skincare products too, because that really is something that is so important. I know, Laura, you are a big fan of skincare products too, because even though you do injectables or things like that, you got to take care of your skin.
No, we have a master esthetician who can give you a tailored skincare regimen, and it is a preventative measure. Sunscreen is critical, especially in that hot South Texas sun.
All right, so Laura, would you recommend this for other ladies, a good kind of entry level when it comes to taking care of your face?
Definitely. It's very important to take care of your face, yes.
All right, so that's a great place to start. You also do other things at the office. You do lower eyelid surgery, brow lifts, things like that. We've got some before and afters as well to show you that. Tell me what's happening here.
No, just, you know, a beautiful woman just needs to look a little bit refreshed. So you have some excess skin hanging over the upper lid, so we're able to clean that out in a blepharoplasty eyelid surgery.
Okay. And then, oh, this is a brow lift. Yeah, that makes a big difference.
So with time, all of us, gravity affects us all, so there is some collapse of the brow into the orbit, so we can resuspend that brow, clean up those upper lids, and it's a nice rejuvenation. This lady, very beautiful woman, just has some lower lid fat pads that we were able to excise. And the procedure I'm offering is what we call transconjunctival blepharoplasty, which is a fancy word for we actually make the incision behind the eyelid, more natural result, less visible scar. This gentleman here, good-looking kid, just had some trouble breathing, wanted to fix the inside of his nose so he could breathe better, and at the same time just taking down a few millimeters via closed rhinoplasty, so all the incisions are, oh, and this is a facial filler. Filler is very popular.
That's a huge difference.
Yeah, so we did underneath the eyes to fix some of that hollowing and some of the lines, what we call static lines, lines that aren't formed by muscle contraction. That's well suited for filler.
Goodness. I might need that. Let's talk a little bit about something called the DermaPen. Tell me about that.
Well, it's a nice technology. It's a newer technology. The medical word for it is transcutaneous collagen induction, where we're using microneedles, sterile microneedles, to stimulate a collagen response. It's a nice adjunct, nice preventative measure because it doesn't involve a lot of thermal energy as, say, like a laser, for example.
And you guys have a special for our San Antonio Living viewers.
We do. For I believe it's the first 20 callers, we are offering a complimentary consultation, if they could just mention San Antonio
Fabulous.
Living, and 30% off Botox.
I love it. It's a great deal, and Laura looks absolutely beautiful. All of the befores and afters will certainly make you want to call. Here's the phone number to find Dr. Shaw, Dr. Shaw Plastic Surgery in the Stone Oak area. The phone number is on your screen. It's 833-7972. You can find him on Facebook or check his website, drshawplasticsurgery.com. And again, the first 20 callers will get a complimentary consultation and 30% off Botox if you mention San Antonio Living. Coming up next, it's a great place to take Dad for Father's Day, plus your chance to win dinner. We'll be right back.
You know what I like about Texas? You can see mountains, beaches, hill country, and the forest all in the same state. And when you want to cool off, you just grab a tube and float down